question for you guys. So let's say you could only make one recommendation to your patients to lower their blood pressure. Which recommendation do you think is going to decrease their systolic blood pressure the most? Do you want to tell them to decrease their sodium to less than 1,500 milligrams per day? Do you want to tell them to increase their potassium intakes, adhere to the DASH diet, or eat 4 tablespoons of ground flaxseed daily? Okay, who's for sodium? Raise your hand.
No, eat.
No, just the 4 options. Increasing potassium, DASH diet, 4 tablespoons of ground flaxseed. Okay, so interestingly, if you look at the systolic blood pressure reductions for each of these options, yeah, something no one's ever heard of apparently has the greatest effect. So this comes from this randomized controlled trial. It wasn't done too long ago, it lasts like 5 years. 110 people over 6 months. They put some of them on an arm of 4 tablespoons of ground flax seeds per day. The others on a control. It was actually double blind, impressively, because they hid the flax seeds in like muffins and things, which is creative and adds to the legitimacy of the result. And they showed that after those 6 months, blood pressure was significantly reduced, 15 systolic units and 7 diastolic units. As for why this actually happens and how this all works, what the researchers reported is that the systolic blood pressure decreases correlate with the levels of omega-3 fatty acids in the blood.
This is why we're talking about salmon.
Yes, we were talking about the Maryview salmon the other day and how great it is that we have access to so much salmon because it's so important. So in order to understand how omega-3 fatty acids do this, let's start by talking about what omega-3 fatty acids are. And in order to understand what omega-3 fatty acids are, I'd like to introduce you to something that I call the dietary fat family tree. So we're going to walk through how all the different dietary fats are related to one another. So the first branch point in the dietary fat family tree is your saturated fats versus your unsaturated fats. So of course, saturated are like butter and red meat and beef tallow and lard, all those sorts of things. Within your unsaturated fat group, you have another branch point, which is your monounsaturated fats or your MUFAs, things like olive oil, avocados, and then your polyunsaturated fats and your PUFAs, also called PUFAs. So within the PUFAs, you have another branch point, which is your omega-6 fatty acids. That's what you get from all of the vegetable oils. So cottonseed oil, sunflower oil, safflower oil, canola oil. And then on the other hand, you have your omega-3 fatty acids, but we're still not there yet. There's many different types of omega-3 fatty acids. So the type that we're talking about in flaxseed is called ALA or alpha-linolenic acid. That's the type you can get from plants. That's the type your body can convert into EPA, which is the type you get when you eat that salmon over across the street. And then that our body can also convert into DHA, which is actually in plankton, which is what the salmon eat, and that's why they have so much EPA that we can eat. So for most of American history, people ate saturated fats. This is just how it was. And this didn't change until approximately 1888, when the first continuous mechanical screw press was invented. Because now for the first time in human history, oil could be extracted from seeds en masse. And prior to that, that wasn't possible. This invention didn't just change, the food industry. It also changed us in fundamental ways in our biology, because vegetable oils suddenly became a dietary staple, as shown here. And the problem is that vegetable oils are very high in omega-6 fatty acids. For most of human history, people ate an equal ratio of omega-3 and omega-6 fatty acids. But with the introduction of vegetable oils into the diet, suddenly this ratio drastically shifted. And today we eat about 15 times more omega-6s than omega-3s. In order to understand why, I want you to think about every single cell inside your body. I think that omega-3s and omega-6s are possibly one of the best examples of how you literally are what you eat. So think about those cells, and particularly, I want you to think about the cell membrane. So as we all learned in high school biology, the cell membrane is made from the phospholipid bilayer, right? You guys all remember this probably. And the phospholipid bilayer is made from phospholipids, which have a phosphate head and 2 fatty acid tails. So what kind of fats are those fatty acid tails often made from? Well, our omega-3s and our omega-6s. And we know that the way it works is if you eat more omega-3s, you actually have more omega-3 fatty acids encircling every single cell inside your body. On the other hand, if you eat more omega-6s, you have more omega-6 fatty acids encircling every cell inside your body. The reason this is important is because omega-3s and omega-6s are precursors for prostaglandins, right, which are basically like inflammatory molecules and chemicals. Omega-6 fatty acids produce pro-inflammatory prostaglandins. They promote vasoconstriction. They promote platelet aggregation, things that sometimes we need, but in excess are problematic. On the other hand, omega-3 fatty acids promote anti-inflammatory prostaglandins, vasodilation, and anti-aggregation, so things that are generally pretty good. Now, I've already given away one thing. They promote vasodilation, so that's obviously going to help with blood pressure. But there's another explanation for why omega-3s do this, which I think is very fascinating and interesting. And it has to do with the actual chemical structure of omega-3 fatty acids. So omega-3s are sometimes called kinky fats because they're so unsaturated. There are all these kinks in the chemical molecule. This is in stark contrast to saturated fats, because saturated fats, of course, have a hydrogen at every spot on the carbon. So you have these long chains, which then can arrange themselves neatly beside each other. And that's why saturated fats are solid at room temperature and unsaturated fats are liquid at room temperature. Omega-6s, they're a bit kinky, but they're not quite as kinky as the omega-3s. So the idea is that it's this shape of this omega-3 molecule that makes the phospholipids unable to arrange themselves so neatly. And as a result, we know that if you have more omega-3 fatty acids in your phospholipid membrane, your membrane is now more fluid and more flexible. And the idea is that this also contributes to having a more flexible blood vessel that then has less pressure that it's exerting. So fun fact, sperm are made from omega-3s. And once again, it's that flexible nature of the omega-3 that enables the sperm's tail to sort of propel the sperm forward. So we see this throughout the body in many different areas. And this is just a study that showed that if you increase omega-3 fatty acid intakes, you have decreased arterial stiffness. So further illustrating this mechanism. So I think this is fascinating because if you look, 4 tablespoons of ground flaxseed per day can decrease systolic blood pressure, like we said, by 15 units, diastolic by 7. If you compare that to the average first-line blood pressure medication, just a single medication, not a combination, we expect a 15 millimeter of mercury systolic blood pressure reduction and a 10 millimeter mercury diastolic blood pressure reduction. So clearly, milled flax seeds, they're almost as good as our first-line blood pressure medications, which is pretty impressive. One very important fact, in order to absorb the omega-3s from flax seeds, they must be crushed. We can't digest the coat. So if you eat a flax seed whole, you just excrete it unchanged and you don't get the nutrients from it. The other thing is they're again, the double bonds, they're not very shelf stable. So they also are best if frozen. Now, if you're fact checking me, and you should be, if you look at the meta-analysis that look at flax seeds and blood pressure, it's very interesting because they will tell you that there is only on average a 1.77 millimeter mercury decrease in blood pressure with omega-3s. But this is a really important lesson here, which is that you can't just read the abstract of a study and feel like you've gotten the message of the study. Because when I dug deeper in this study, what I realized is that they're actually comparing apples and oranges. They combined studies of flax seeds with studies of flaxseed oil at all kinds of different doses and then put it all together and said, well, there's no effect. So my message to you is if you really want to know the truth about something, you have to read the tables because otherwise you might actually miss something that's actually apparent. So maybe you're thinking, well, what about the fish, the omega-3s from fish sources? Can this have the same effect? Research shows it can, but the problem is it's unsustainable to eat fish every single day, right? There aren't enough fish in the ocean. There's not enough to go around. Also, there's issues with dioxins and things like that. So yes, when you eat salmon, you're getting omega-3s, which are also helping with blood pressure, but it's probably not the option that we can go to every single day to get the dose that's been proven to have that effect. And then you're probably also wondering, well, what about omega-3 supplements? Isn't that a good option we could go down? Interestingly, the Cochrane review showed no effect on blood pressure when you take omega-3s in a supplement. One kind of golden rule of nutrition is that supplements never perform as well as foods. And there's so many different reasons why. In the realm of omega-3s, the reason why is there's probably a couple different reasons why. One, omega-3s are very, very vulnerable to oxidation. All the double bonds makes sense, right? And these supplements, we know, even if you buy the best quality supplement from the best provider, they're always like half of them are oxidized by the time you consume them. And that's actually a theory as to why these cardiovascular trials never work out, is because often you're ingesting something that is like an oxidized fatty acid. So you're actually doing more harm than good. The other thing to keep in mind is, of course, flax seeds have more than just omega-3s, right? Nature packaged these foods in such a way that there's a lot of synergies and there's a lot more going on than just one nutrient. Again, the dose is crucial and key, and these sorts of reviews always compare apples and oranges with many different doses. And finally, as I already alluded to, you guys, there's all these different types of omega-3s, right? And this study is about omega-3s in general. So is it the ALA? Is it the DHA? Is it the EPA? We're comparing all of these different things. So it makes sense to me that the Cochrane review would show no effect on blood pressure because it's more of a specific question that needs to be asked. I mentioned this already. Stored in the fridge, double bonds, very vulnerable to oxidation.